Hi, Jim. My name is Jasmine. I'm here to go over some lab tests that your doctor's ordered for you for your liver. There are 7 tests. With all of the tests, we will notify your doctor of any abnormal findings and we will educate you on any results. For all of the tests, during the test, blood will be drawn and a sample will be placed in a tube, and oftentimes pressure will be applied until the bleeding has stopped. For the AST test, we're looking for a normal range of 10 to 40, and this one is ordered to test for tissue damage in the liver, heart, muscle, and kidneys. If you're taking any opiates, Tylenol, or other drugs that are known to affect the liver, or doing any strenuous exercise, we ask that you don't do that before this test. It will affect it. Fatigue, abdominal pain, and nausea are signs that your levels are high, and muscle weakness, fatigue, and difficulty with protein metabolism are signs that your levels are low. This test is a 3 blood draw, so 3 days in a row your blood will be drawn, but there are no fluid or food restrictions. And after the test is over, you may resume your medications. For the ALT test, we're looking for a 10 to 40 range. Liver damage or inflammation is what we're testing with this. And opiates, morphine, codeine, Tylenol, and aspirin all should be avoided before this test. Jaundice, loss of appetite, and dark urine are signs that your levels are high. And fatigue, weakness, and signs of nutritional deficiencies are signs that your levels are low. There's no special things before this test besides those medications. There are no fluid or food restrictions. After this test, you can resume any medications. For your ALP test, we're looking for a 50 to 120 range, and this is looking for liver or bone disorders. Age and gender do affect this test, and eating fatty meals will affect it. Jaundice, bone pain, and itchy skin are signs that your levels are high, and numbness and tingling are signs that your levels are low. You will have to fast for 8 hours before, and there will be some slight discomfort. After the test, though, you can resume that normal diet. The next test is your direct bilirubin, and we're looking for less than 0.5 with that one. This is checking for bile duct blockage. This test is very sensitive. Any exposure of the sample to sunlight or UV rays can affect it, and some medications, such as barbiturates, can affect it as well. Jaundice, dark urine, or pale stool, those are signs that your levels have increased, but there are rarely no signs that your levels have decreased. There's no special before testing, and you can apply pressure to the site until the bleeding stops when we're done. Your next test is going to be your total bilirubin. Now this one is a 0.1 to 1.0 range that we're looking for, and this is assessing liver functions. Again, very sensitive with the light and UV exposure and some hepatotoxic drugs as well. Jaundice, itchy skin, and fatigue are signs that your levels are high, but they are rare and there are no signs if your levels are low. You will have to fast for 4 hours before this test, and we will verify who you are with 2 patient identifiers. We will apply pressure to the site until it stops bleeding afterwards, and we want to prevent a hematoma with that one. The next test is going to be the albumin, and this one is looking for nutritional and liver status. Penicillin and aspirin can decrease these results, and heparin can increase it, so we want to watch those. Some rare increased level side effects are going to be dehydration, dry mouth, and thirst. And some decreased side effects are going to be edema, poor wound healing, and fatigue. There are no fluid or food restrictions, but medications may increase this, so let's watch those ones I talked about. And afterwards, you can eat a high protein diet after. Your last one is going to be your total protein, and this is looking for chronic illness and nutritional status. Any contrast beforehand can affect it, and you do need to notify the lab of any medications that you are taking. Dehydration, fatigue, and joint stiffness are signs that it's high, and edema, muscle wasting, and brittle nails and hair are signs that it's low. There's no fluid or food restrictions for this, and after the test, you can resume all your medications. Do you have any questions?